This trigger film was developed for health services to use as part of an experience-based co-design process, EBCD. EBCD is a patient-centred quality improvement process. The film is intended to get local people, patients, families and NHS staff talking together about how they can jointly improve people's experience of health services. You can find out more about this process and how to use trigger films by accessing this link to the EBCD toolkit. This film draws from a collection of 56 interviews with people affected by stroke. The interviews were conducted across the UK by the Health Experiences Research Group at the University of Oxford. It includes people talking about what happened when they had a stroke, hospital care, communicating with health professionals, rehabilitation and issues relating to personal care, about making the transition back home, and dealing with difficult emotions. The full study can be seen on www.healthtalk.org. We'd like to know more about how you use this or other trigger films in the collection, and would be grateful if you would spend a few minutes completing the feedback form. The link to this is on this page.
What I take away from that myself is that it is possible to be very ill indeed, suddenly, without even looking back on it, without any warning sign. And I suppose the reason is that what I had wrong with me was very high blood pressure, which I now realise, having examined this many times, doesn't necessarily have any telltale symptoms. You know, no heart flutters, no things like that, no obvious precursors to what in the end was a very severe illness.
Well, it was, I was lying in bed and my partner had gone down to make a cup of tea. And when she came back up, she said, "I think you've had a stroke." She noticed that my left side of my face was drooping. But I don't remember anything about it, didn't know anything about it. There was no pain, no loss of consciousness. It's completely out of the blue to me. I didn't believe it. And anyway, she called for an ambulance.
You were telling me there about when your daughter found you.
From what I've been told, she found me on the floor and I couldn't move at all on the left-hand side. I couldn't speak, nothing. She panicked. And she phoned her sister, and two of them phoned the ambulance. So the next thing I remember is I woke up in the hospital.
Then I got into the emergency, and I was put on a trolley, and nobody looked at me, not even in my direction, for literally hours, until I eventually saw a doctor, and she said, "We'll book you in for a scan about 3 o'clock tomorrow." So what was all this urgency about? What's the FAST campaign about, you know?
There was actually times on the ward where I wanted help. I didn't feel there was anyone there that I could ask it, that I felt comfortable to ask for help.
They had a very strict, restricted schedule, like in a 10 minutes to a patient or 15 minutes to a patient. That to me is not, the moment you are told and the nurse will look at the watch, you feel disheartened, you know. I think she's not interested in me.
I suppose you go into a hospital with an illness and they've no idea about your lifestyle or, you know, your integrity, how you live your life. And I didn't feel as if there was very much respect there on several occasions. It could have been done a lot. Some of the questions could have been asked differently or worded differently, whereby I didn't take offence. And I was very emotional when all said and done. That was part of having the stroke. It made me tearful and cry. And I wasn't intelligent or articulate, and questions were asked, and I was just a bubbling wreck because I was in total shock. And sometimes I felt that the consultants didn't treat me as a person enough. It was more as if I were just another case or another piece of paper or another case study, really, rather than me.
They didn't explain why it was happening, and for me that made it much worse, because if they'd explained to me I could have understood. They're much used for it for older people, so they just kind of did what they would normally do for me, for them, which wasn't acceptable. I would say the youngest person there was about 70.
Right. I mean, in the whole scheme of things, and how did that make you feel, being in the hospital and the health professionals not really kind of communicating really effectively with you? And
I think that really impacted on my recovery, because I really suffered afterwards. I kind of went into a depression, but it wasn't a depression, normal depression, it was from the stroke.
I had a chart on the wall that said, like 1, 2, 3, 4, 5, 6 stages that I had to achieve before I could go home. So that was a good landmark. It was like feeding unaided, walking unaided, things like that. I don't know which order they were in or whatever. It also said that if I fell out of bed, they had to have a hoist to lift me, and I'm afraid I still have a weight problem. But going down this list, really, and yes, I can do that, yes, I can do that. That was good, that list on the wall. I don't think it was meant for me, I think it was meant for the nurses. So having little markers to achieve helped.
I think the men found it very difficult to deal with, because at that stage, we had to have 2 people, 2 nurses to take us to the toilet, and a third one had to be there as well. Now, I think for women it's probably easier to accept these sort of things, but I felt very sorry for the men. I think they felt they'd lost their dignity, and it was very difficult. And then, so we were taken to the toilet with 3 people, 2 people, one either side to hold you, and the third one to deal with other things. And then in the mornings with washing, again, you see, we had all these, there's always the washing problem, and they tried to make us help ourselves, tried to make us independent.
I was kept in bed, flat on my back, and if I wanted to go to the toilet or have a wash or anything, I had to have somebody wheel me there. I mean, after a while I got to the point where at least I could go to the bathroom on my own, if they would leave me alone. I had to appeal to the consultant to say, look, I'm okay to do this on my own. And he persuaded them to let me do it, because I found it difficult doing things with people standing around watching me. I was as far as you can possibly get from the bathroom in an open ward. I mean, surely it doesn't take a great mind to say maybe we can move him down near the bathroom, or maybe we can put him in a side room where he can take himself to the toilet.
They brought a thing of water to the bed and a flannel and some soap, and the first day I washed myself in bed and I cleaned my teeth after about 4 days. It was absolutely wonderful, and that was a turning point. And then the next goal was I get into that bathroom and I have a bath. Well, I had a shower actually. It was much easier to sit in the shower at first. But I managed it that way, and there were grab rails at the side that you can hold on to, and the nurses will stand by. There's no chance of you having a fall. They were great. They give you the respect. They'll stand outside the room while you get your underwear on or off or whatever. That to me was just the first stage in a long recovery, but it was such an important stage, being able to keep myself clean on my own. That sounds silly saying that. Just something you take for granted every day. You get up and have a wash.
They tried their hardest. They're a small community hospital. But, I mean, for example, that one day when Mum has always been a person that wears trousers. She's not one of those ladies that wears skirts, but it was more convenient for Mum to wear a skirt for toilet purposes. And Mum doesn't have very many skirts. Well, we bought in as many skirts as we could, but there was one day when we came in and they'd put Mum in this crimpline dress which was too small for her. And I was livid, wasn't I? What the hell have you got
just
on?
Went puce.
And so I felt that there wasn't enough care and consideration in what they were dressing Mum in, but it was because it was more convenient for them.
And I like the idea of young stroke survivors, because it's very different with respect to older people. It's very different when you're 41 and disabled to when you're 75 and disabled. You've got a whole different range of issues to be dealing with because you're younger. And then some of me thinks, well, what help will I really get from being around stroke survivors? Now, maybe I'd get a lot, actually, because it's like having one foot where I'd like to talk to people who've had strokes, and another foot that says, well, and one foot where I'd like to talk to people who've had strokes, and another foot that says, well, really, you need to get on and move forwards and integrate that into your life.
Can you perhaps tell me about some of the things that made it helpful for you to get back to being independent?
I really think just about everything. That's not going to help you, but I think, honestly, I really think almost everything has helped me from the very, very start of the therapy, lifting the wee pegs. It sounds daft, but it's been great. It still impacts on the home when you're, imagine making a cup of coffee, lifting the spoon, which again is no great control, but I can lift coffee and stirring it, and that is, it brings into effect your wrist and your arm movement. All these types of exercises, the occupational therapist has obviously worked on these kind of things, which has been a great help. Brings you the confidence to try these things anyway, because I was finding I didn't have the confidence to try these things because you're thinking, oh well, I've not got the strength, I've not got the control, so I'm not going to try it, but to me it all worked part and parcel, occupational therapist, physiotherapist, the gym, confidence building up, strength building up, your ability to do the actual operations is building up, and it's absolutely been absolutely superb. I can't speak highly enough of the help I've had, I really can't.
Is there anything else that you want to get across to other people from your experiences, that either to other people going through it or to doctors and nurses that you think they ought to know about?
I wish there would have been some assistance with mobility.
Mm-hmm.
I would like to have had more exercises to my legs, if possible.
Mm-hmm. Mum found it a bit hard that the physios, they realised that there wasn't as much movement as they had hoped for, and then here there's very little, apart from the exercises, as Mum had said earlier. And I think Mum misses the exercises. I think even if they do feel that the patient is unable to do things, I think it would be nice for the patient if the patient
to
is
have
enthusiastic.
An idea that you can have a try.
Yes, to just try and just, even if it's the big toe or just moving the foot round, just any kind of encouragement to keep the body fit. It would be quite nice if they did just carry on doing some kind of physio. That you've really missed not doing any of the physio, haven't you?
Yes.
The only thing I think perhaps the transition between hospital and home could have been a little bit softer. It was a bit like jumping off a cliff. I hit the ground at home with a bit of a thud, and that was very hard for us all. Perhaps we could have had more sort of one-day supervised visits at home to get me used to the place, but maybe that's expecting too much. It was hard. I'm not saying I've got the perfect answer for it, but the nurses in the hospital were fantastic. But that was part of the issue, that going from 24/7 care to having a wife and 2 children and having to look after myself to a large extent was a big jump. I guess the whole point is life at home involves days, nights, it involves times where the children are here, times when they're not. It involves, you know, there's so much that being a dad and a husband in a house with 2 kids involves that was a shock for me to come home to. I haven't got the perfect answer how to make that transition, other to have perhaps I could have had more whole weekends at home before I came here permanently. Perhaps my wife and I could have been counselled or had more discussions about how we were going to deal with these challenges and how we were going to face up to them. And a lot of the things I didn't realise how difficult it was going to be till I actually got here. One of the things I think was the children are very noisy, as all young kids are. They run about, they play fight, they argue, they laugh and giggle and throw cushions around and just all sorts of things. And the chaos, having had a brain injury, coping with levels of chaos is quite difficult. And coping with the chaotic, children leaving toys on the floor, and the busyness, the manicness of this household from a hospital was a hugely mentally and physically challenging thing for me.
The medication side, the chemist, I was putting out her medication on a daily basis, but then I was supposed to be not going every day. And there were some times if I had to do something for my daughter or whatever that I've missed a day. So the chemist himself, I thought was an excellent service, came along to my mum's. He sat with my mum and I, and we had a meeting, and he went through everything, every medicine that she was being prescribed, and told us exactly what it was for, which was excellent. She does get tablets from the doctor. As I said, the chemist came along and discussed all the tablets with us, and she now gets them on a weekly basis in a bubble, which is excellent. And you can see what day, and if it's morning or if it's tea time, or it's an excellent, I really think it's an excellent service. That's saved a lot of worries, actually. That, if I hadn't the tablets laid out ready, the carers are not supposed to do that. So, and sometimes my brothers or my sister are not sure what tablet she gets, although it was written down, maybe couldn't find it or what have you. So that's been a wee worry as well. But this bubble thing is just absolutely wonderful. Thoroughly appreciating that. I do think that there's one really important thing, and it was something that I was going to get involved in, and then unfortunately I was not able to go on. But there was a group of us that thought it would be a really good idea that when a stroke victim was going to be released from hospital, somebody who'd had a stroke and had been home for a time should go to the hospital and have a little talk with the person who is going to be released and explain what happens when you get home. That, I think, is a very important thing, because more than anything else in the world, you want to go home. And when you get home, I have to say that is the last place you want to be. Now, again, my husband couldn't understand that the day I came home, I should have been absolutely overjoyed because I was home. But I think it's something to do with a feeling of insecurity. You're very frightened that you're going to have another stroke and that you haven't got nurses around you. Whereas in hospital, you feel very safe. I mean, there were a couple of times when I did think I might be having another stroke, and they were there immediately. The doctor came. You felt very safe, but immediately you come home, you are on your own. And it's a very frightening experience.
I mean, the social worker in the first hospital I was in was brilliant. Absolutely superb. Fantastic woman. Well, she was the one, I mean, she was the one that I felt I could really cry in front of, because I wasn't going to hurt her. She wasn't my parents, she wasn't, you know, I mean, she'd say to me, your parents have told me how well you're doing, yeah, and they need to know that doing well isn't about being brave and stoic all the time, because what you've happened to you is serious and very bad, and it is okay to cry. But it was her I used to cry in front of sometimes. Yeah.
My GP has arranged for me to see a psychologist via the NHS, which is quite impressive because usually it takes ages to see these people. And I've seen him a couple of times, and he's given me some, well, he did some diagnostic tests first of all, which I never got with the CBT specialist. And he said it wasn't so much depression, it was anxiety more than depression.
What sort of things do you feel anxious about?
Well, anything that's a bit sort of, that's going to require me to, you know, to tackle something that I might not be up to. I do sort of feel concerned about whether I'm going to be able to cope. Whereas before, I used to consider myself a great coper.
My message to the healthcare professionals and the doctors is listen to the patient. Listen to the patient, because the patient knows what's happening inside him. At least I do. And, you know, just take the time just to sit down with them for 5 or 10 minutes and just have an in-depth chat with them, and also explain to them what is going on, explain to them what's happening. Because I find if one knows what's going on, if one knows what's wrong, they can manage it better. I always say to them, I've had a stroke, but I'm not stupid.